All right, thanks. So why are we doing this? What is the whole point of this? Is not to get you to have a goal of being healthy, but being healthy is a mean for you to achieve your goals. And I have a lovely couple there. Those are my patients. He just turned 80. And he had been telling me, well, my goal is to get to 80 and do 80 miles on my bike the day of my birthday for 1 mile. His birthday is in January. But I mean, that was important for him, so I worked with him and get him ready and so on. The point is for you to achieve what you find, what drives you, what motivates you. You know, life is there to enjoy it, and I just want to help you to do that. I just don't want you committing suicide with a fork. Medical studies have shown actually that certain foods are really pro-inflammatory. They cause a lot of inflammation. And well, what's the problem with inflammation? You will say, sometimes, you know, if I get a bump, it gets inflamed, my body repairs it and it's good. But when you have continuous inflammation in your body, it causes cell damage. And then your body has to repair those cells. Now, do you have any idea how many cells you repair every minute? About 300 million. And each cell, they have the DNA, the whole DNA for your body. It's about 6 feet tall. You have to uncoil it, copy it. Your body's cloning that. And after you copy that DNA, then you have to coil it back and you get the brand new cell. Now, if you're doing that 300 million times a minute, well, you got to believe that your body is really amazing. It really is. And then what happens if you add extra burden? Well, you're damaging more cells. That there's a moment that you start making mistakes when you're repairing cells. And when that happens, those little mistakes in the DNAs, they're called mutations. And if they happen in a bad place, where you get cancer and you get the chronic diseases and so on. But your body has the ability to regenerate. So given the chance, once you stop the inflammatory process, your body's able to reverse everything. So it's never too late. And this is the point of doing this. So, Dave, please. I'm going to tell you what the medical studies have shown. When you concentrate on those 4 areas, they looked at a bunch of medical studies, and the ones you can't see, well, there are a couple seats there if you want to come. Yes, there are more. So one is what they call healthy eating. And you know, what some people call healthy, other people say, well, what is healthy? So they came to a consensus. If you're having about 5 servings of fruits and or vegetables a day, and these days an apple is 2 servings, so it's not that much. A handful of blueberries, that's an extra serving, and then you have the vegetables you're eating. So it's easy to achieve that. So if you do that, that's considered healthy eating for that. And then avoiding harm, not smoking. I mean, smoking is really terrible for you. So if you don't smoke, you will significantly live longer and healthier. The other thing is physical activity. How much physical activity? You don't even have to join the gym. I hope none of you own a gym. But you know, the point is that I'm trying to say is you go out and you walk 12 minutes out, 12 minutes back. That makes 150 minutes a week. That's it. That's all it takes, really. And the last one is a healthy weight. Now, I have a secret for you. Skinny people die too. So it's not about being skinny. But the point is that when your weight is healthy, you are less likely to develop chronic medical conditions. That's the whole point. So my goal is not really to get you to be slim, but to be able to do everything you enjoy. And everything else we work with. So the 2 goals that I have for myself and my patients are, number 1, no need for nursing homes. And number 2, no Alzheimer's. Everything else is, you know, we can deal with. Now, why do people go to nursing homes? Because they lose the ability to take care of themselves or do things. So if you find yourself that you're losing more and more abilities in life, well, it's time to take action to reverse that. Don't settle for that. You don't have to. We can reverse it. So, Dave, please. So the studies have shown that those kind of meals are really pro-inflammatory, and they cause severe damage to the lining of the blood vessels. And when that happens chronically, it's associated with damages in which plaque begins to accumulate. And if they break and they close up your blood vessels in your brain, you get a stroke. If you get the blood vessels in your heart clogged up there, that's a heart attack. If it happens in your legs, people have what we call peripheral vascular disease, and they can get ulcers and so on. Next, please. So I want to show you these slides, and I'm not going to talk too much about the medical study, but normally one would think that one of your blood vessels in your heart, they get clogged, well, I got to have a stent. But they did a study, and they put people with narrowings of the blood vessels that were not amenable to be stented, and they could not get a bypass. They put them on the plant-based diets. And look, after just 2 years, how the blood vessel looks completely healthy. It reversed. We don't have medications that can reverse that process. But just by eating properly, you can. And the one on the top, that's a nuclear stress test. And where you see the little arrow is not lighting up, it means the heart is not getting enough blood flow. And after the period of time that they were doing, you can see how the blood flow is restored. So it's completely doable. Well, what about if I have a genetic predisposition? Well, it's true, but if you have a drawer with tools, are you more likely to use the ones on top or the ones at the bottom? The ones on top. Well, your DNA is super long, and I just told you it's coiled. So if you turn off the part of the DNA that is related with repairing and inflammation, and you start using the other ones, you don't express the genes that are associated with cancer. So your genes do not determine your destiny. You can change that by turning genes off, turning genes on, and that's very important. There are studies done with breast cancer and prostate cancer that have shown that. And I didn't write all the medical studies for you, but they're there, certainly. Next, please. And those are the genes that I was telling you. And if you see pre-intervention, this is just 3 months when the genes, and these are guys with prostate cancer, those genes are, when they're red, they're turned on. When they're green, they're turned off. And after just 3 months of a diet change, you can see how the genes were turned off. The same thing happened with breast cancer. Wow. So you've got the power. You just have to employ it. All right, next, please. So the recipes for today, I have these things in particular for a reason. Number one, to be honest with you, easy because I can share it. You can all try it. But number two, those ingredients, the flax seeds, they have these lignans in them. They're powerful, powerful anti-neoplastic agents. So they work against prostate cancer, breast cancer, and all kinds of different malignancies. They have a lot of fiber, so they work against constipation, and they have the omega-3 fatty acids. So you get like a lot of punch out of those flax seeds, and you need to have them ground, because otherwise you just poop them out. That turmeric is a root, and it's actually one of the ingredients for curry, and it makes it yellow. But the active ingredient in the turmeric in that root is called curcumin, and it's a potent anti-inflammatory, and it's a potent anti-cancer agent as well. So it works wonderful. We've seen people with osteoarthritis, we put them on the turmeric, and the medical studies show that it's better than ibuprofen. So the nice thing, at least for me, is that when you add black pepper, you enhance the absorption of that turmeric. So use some black pepper to taste there, but it works great. Beans are associated what we call legumes. They're associated with longevity, and they have a lot of antioxidants. There are 5 kind of beans that tend to have the most antioxidants, and they are Number one, lentils. And after the lentils, you have the chickpeas. Then you have the small kidney beans, red kidney beans, the black beans, and then the last one is the red kidney bean. So those are the top 5. So we're doing something with kidney beans today for you as well as with chickpeas. Spinach, it has a lot of things that, not just that make you like Popeye, but they have that lutein that keeps you from getting macular degeneration. And actually needs a little bit of fat to be absorbed. So that's why we mix it with avocado. And it works wonderful. So it is very good. It has a lot of fiber. And the avocados, of course, has the monounsaturated fats that are really healthy for you. So I guess we couldn't, next, the last one. We couldn't add my email, but if you have, I'm putting up a little thin pamphlet. If you have great recipes, feel free to email me if you have any questions. My email is maprieto@capecodhealth.org. Cannot answer medical questions, though, but feel free to email me there. Do you have any questions before we start cooking?
Could you repeat that, please?
maprieto@capecodhealth.org. All right. Hello. So for us, when we're doing the hand washing in between patients, the training is we have to sing happy birthday. It takes 15 seconds to do it. All right, so what we're doing today, you have the recipes. One of them is gonna get started is the brown rice, and it's just I actually like a lot the quinoa and the wild rice, but those take much longer to cook. And because I'm trying to tell you to use non-processed stuff, well, I have to do everything from scratch. I didn't, so I'm just gonna start doing the rice here, and oops, for every cup of rice that you do, brown rice, you need 2 1/4 cups of the liquid. So we made some veggie stock there, a lot of antioxidants. And then we'll bring that to a boil. And after that, we'll just add the brown rice. They do sell like mixes the brown rice with the wild rice or the quinoa and so on. And I never tried them like mix. I just cook either the quinoa or the brown rice or the wild rice. But you certainly can try it your way. For the white rice, the one that is very tasty is that basmati rice, which because it's Indian, it goes with the recipe. But we like to use the whole grain as much as possible. That's why we're doing the brown rice. So I'm waiting for this to come up to a boil. And while that's coming up to a boil, so I'm gonna start cooking. Oh, one thing I didn't tell you, everybody asks me these questions about oil. How come you don't cook with any oil? Well, the medical studies have actually shown that fats cause insulin resistance. What is insulin resistance? Is the ability of the insulin to bring the sugar from your bloodstream into your cell. And the fats, they block that mechanism. So if you have someone who goes on a keto diet and you have someone that goes on a low-fat diet with a lot of fruits and vegetables, after just 2 weeks, they both have low sugar levels. But like pregnant women, if you give them that glucose low, they have to drink that sugary drink and they check the blood sugar level. The ones doing the keto diet, they have twice as much the sugar level. It's because the fat is messing up the insulin and the way it works. So I try to avoid oil at all point. It's really not that very nutritious, doesn't have as many nutrients because they've been pulled out during the processing to get the oil. So instead of, olive oil, I just chop olives and put that in the pan. So let's start also while that is doing that. So I'm gonna add, I have here the chopped onions. I don't know if does that show on the TV? No. Okay. I had them, pre-cut before I came. And I need a cup of leeks. Leeks are really healthy for you, and they're quite tasty too. So I need a cup of that. So after I buy them, I just slice them and then freeze them. And they stay in the freezer for a long time. And there you go, 1 cup. And a little bit of garlic. Right, I don't use oil for that reason. I just use avocados. Right, right. So no, that's not, all right, so that we'll get that going. So I use the red onions, which are mostly used for salads because they have a greater concentration of antioxidants. So that's why I use the red onions, and it won't look red after they're cooked. Okay, I like medium heat there. Perfect. So it actually gives it like a roasted vegetable taste. Let's see if that's not coming out yet. And while we get that going, I'm gonna get ready. So I did this, no, those, where are my, oh, here. I was trying to make diced tomatoes. It didn't work, it's just chopped. But I fire roasted them. What I did is I just put the tomatoes on the grill. But sometimes, during the winter, I just put them in the oven. But I put them on the grill and the skin peels off, and then fire roast, nice. And then I put them here and I chop them. And it works really well, and they're tasty. You're not getting sodium from the cans or things like that. So let's see here for the kidney beans. So one of the things that I've noted, and actually they did some studies about this, is that people find the food initially very bland, and what happens is you have an up-regulation in your taste buds. Like the first time you try something, you love it. But then you eat it again, and it was good, but not as great as the first time you try it. And if you keep eating the same thing, it's not as flavorful because it's a down-regulation of the taste buds. So the moment you come off the axle of evil, sugar, salt, and trans fat, you begin to downregulate the taste buds, and you become sensitive to flavors and tastes that you were not able to perceive before. So I normally don't put any salt, but I did put in there salt to taste, because I presume that not all of you eat like that. I put a little bit of salt, not much, because I don't know what medical conditions you have, and I don't want to cause any problems there. So let me add the diced tomatoes. 2 cups of the chopped tomatoes, yes. And we'll get that going. And while that's just blending in there, I'm gonna get in the rice in. And after it's boiling, you just bring it down to a simmer, and Siri set the timer for 23 minutes. You asked Siri to do it. Well, it didn't do it. How about that? All right, there you go. And she'll tell me when the rice is ready. So while that's cooking, so we'll keep working on this. So this is developing the flavors of the leeks with the tomatoes and the onions and the garlic. And then we're gonna add the spices. And the spices for this, as you can see there, so I have a little bit of the cumin, which is like a smoky flavor, the turmeric to bring down your inflammation, coriander, which is the seed for cilantro. So I just put them all together, and I'm gonna add that. And we'll mix them all together. And I don't know if you can smell it, the smokiness of that cumin is like, wow, it's really good. And after that's incorporating, let me get this one started. So one of the beauties of this plant-based cooking is when you do what we call batch cooking, we just do a lot of things, and if you do it socially, you get together with 2 or 3 friends, and each one does one part, and then you just all share. And then you just have the building ingredients in the refrigerator or the freezer and use them together, and you have those cooking parties together. They're really nice, actually. So we have that. I'm gonna add a little bit of the veggie stock to the beans. And you go. And here's when after I add that, I'm gonna add the ground flaxseed. And you know, flaxseed is a great egg substitute. You know, once you mix it with fluid, it becomes a little, almost like a gel, and it thickens things.
So you buy the flaxseed just whole, or you have to crush them yourself?
You can use a coffee grinder, or you just buy it ground. You know, if you buy it ground, you have to use it fast because it does lose some property. And but if you actually eat a tablespoon of flaxseed a day, which is what's recommended, you go through it quite fast.
What about flaxseed oil?
It's the same answer. I don't use the oil. I mean, you lose a lot of the nutrients. So I mean, it does have the omega-3s, but it doesn't have the lignans and it doesn't have the fiber. So you lose a lot of benefits. So these are it's a large onion that I chopped. And again, I use the red onion. And the garlic I just chopped. I chopped that right before coming, so it's pretty fresh. And now I'm gonna add the I'm cheating. frozen butternut squash dies already, but frozen retains the properties, so we're using it. And with some water. So what we're gonna do afterwards is we're gonna smash those butternut squash, and we'll make like a puree. And to that, I'll add the other components of the curry, and it will come out quite good. Well, I hope you agree at the end when you try it. So while Doc's doing that, let me take a quick look here. Make sure this is going well. Okay. This is too low. Okay. Okay, I think this is looking quite good to add the other part. We're almost done with that dish, so I'm gonna add the kidney beans. So you can bite them and boil them, or you can use the Instapot or whichever you have. If you're gonna use canned, please just buy the ones that say low sodium or no sodium, and anyways rinse them. So let me mix those together there. So Roger, gonna put him on the spot there. You want to help me out? How about chopping the parsley? I already washed it and ready to go.
Set to go.
Yeah. But it's looking nice. All right. Let's see here. So, any questions so far? Pardon me?
Curry.
Yeah.
Curry is just what somebody puts together themselves.
Right.
It's not a spice unto itself.
No. And I put on the recipe there, it tells you which spices you need to make your own curry, which is how we did it. Yes.
You're talking about that you roasted the tomatoes. So in general, aren't we supposed to stay away from a little bit of doing a lot of cooking on a grill?
So that's an interesting question, There are certain chemicals that form with, when they're exposed directly to the flame. And those things, thank you, Raj, they can be carcinogens, yes. But when I roast the tomatoes, I don't do it at a very high flame. Actually, I have a gas grill, so it's not that I can regulate how much. And it's just enough to peel the skin. And then the tomatoes, they just cook differently than if you boil them.
It's not like real high heat.
No. Likewise, you know, the recipe doesn't call it, but after I peel the eggplants, before I dice them, which Roger is going to do in a sec, I actually grilled them too. And that was on medium heat, so I will get the grill marks, and it gives it the distant flavor, but they're not charred. So, next. Okay. So that's what they look like. And I like them grilled, and they're nice. So if we can cut those in cubes. Yes. I'm sorry, this doesn't let me hear you, sorry.
I'm not really very familiar with this particular garam masala.
Garam masala, yes. And that's something I tried new last year, actually, after my sister told me about it, but they do sell it in the grocery store. Yes. I don't know if that's a spice in itself or it's a combo of spices too. I think it's a combination. Is that right? You don't know? The garam masala? So I'm smashing here the butternut squash. And it makes sort of like a paste. So instead of adding flour as a thickening agent, I'm just doing it with butternut squash, which is much healthier that way. Now, there are some studies done about, there's a group of people that belong to a certain denomination in California, and they're concentrating in an area of California. In fact, like the grocery store where they live, they don't sell any animal products and so on. And that seems to be one of the called blue zones in the world where people tend to live the longest. And of course, they eat a plant-based diet, but they do have a lot of things besides just eating plant-based. They have a very strong social aspect, particularly also with exercising. A lot of the social things they do are related to physical activity. There's a doctor there, you can actually Google it, the 100-year-old cardiologist. And the guy was operating until he was 95. Yes. And his last name, I remember it because it's the name of one of our towns here. His last name is Wareham. And I think he's about 103, 104 now. But he says, you know, like, I don't have an acre of pain anywhere in my body. I'm active. I can use my mind the same way I did when I was in medical school. And yeah, he had some limitations. That's why he stopped operating. But you know, if I was going to have open heart surgery and the guy's 95, you know, it gives you pause there. But he was helping there. It's pretty amazing. So this guy was in great shape. All right, so I'm doing a less than optimal job smashing this thing with the spatula, but that's okay. And I'm about to add the spices here. For the curry. Okay. I can hear what they're
exercise
saying.
for the
Yeah.
back.
Oh.
This works out well. We'll take the show on the road.
All right, and let me add the tomatoes. This, the recipe that you have, you know, which I'm doing double that because we're so many, but it calls for 2 cups there, so we're doing a little bit more, which is actually precisely measures the whole thing. I had measured it before, so there you go. Now, there are reports of people with already metastatic cancer that go on a plant-based diet and they're able not just to control it, but to reverse it. And it's a famous person, I'm not gonna give names, and he was diagnosed with a mass in his pancreas. I mean, pancreatic cancer, so that's not a good thing. And they caught it early enough, but he decided not to do surgery. He just went on a plant-based juicing diet, lost quite a bit of weight. This is a famous person, but I'm not gonna say who it is. And after 1 year, the mass was still there. Most patients with pancreatic cancer die in less than 1 year. And so he decided to have surgery and so on, continue with the diet, and he lived on for about 6 or 7 extra years. Highly active CEO of a very successful company. Eventually, the cancer actually spread to his liver. Well, him being CEO had a lot of money. He bought himself a new liver. It didn't last too long with the cancer. And he eventually died, but you know, after 7 years with pancreatic cancer. So he's amazing. And I always tell my patients to watch that documentary because it's based on medical studies, Forks Over Knives. And on that documentary, there's the case of a lady who was diagnosed with breast cancer that was metastatic, and she went on the plant-based diet and things to eat in particular to help that. And 30 years afterwards, she's cancer-free, doing very well. So, and that's the beauty of things. There are certain things that work for certain cancers or others. In where I did the training for the lifestyle medicine at Harvard, they actually have an oncologist that runs a lifestyle clinic, which is for patients with cancer, and according to what cancer they have, they give them certain things to eat, and they're able to arrest the progress or reverse it of the cancer, which is very nice. Okay, so this is looking good. I'm going to add the chickpeas or garbanzo beans. They have a lot of protein. This is where we get the hummus. Thank you, Raj. And I'm going to add the spinach. Again, this is frozen, but you can do fresh. Thank you. Since I'm a guy that loves to eat, one of the advantages of eating plant-based is that you eat a lot. Well, there aren't that many calories, so I feel like a hobbit. I have first breakfast, second breakfast, third breakfast, and so on. And but I don't gain weight. In fact, when I first became plant-based, that was in 2017. I've always been active with exercising. I enjoy cycling. I used to, sometimes do 70 miles on my bike, so 50 miles or whatever. When I first went plant-based, like after 25 miles, I have nothing left in my legs. So I asked the doctor that was mentoring me, Dr. Siddhartha, which you probably heard of here in the Cape, and he told me, well, but you're eating the quantities for someone who's not exercising this much, and he told me what to adjust, and that all came back, and I do feel fabulous. So I had to increase the amount of protein I was eating, like seeds and legumes, and I started adding, I needed more non-processed carbohydrates to energy to burn. So my wife started making whole grain bread at home, which is very nice. And I added that particularly the days that I'm going to exercise quite a bit. But I get hungry, I eat. And so I'm not like going hungry during the day. And it's good, because I love eating, so you get to eat a lot. The other thing that I get a lot of questions about is, how about your bowels initially when you make the change? So right now I'm gonna add the diced eggplants, and I put that in the recipe as optional, but I like the eggplants, so I put them in. And what happens is, probably you heard about it, the microbiome, the bacteria that we have in our colon. And when you are omnivorous, meaning eating fruit, vegetables, meats, and all that, you have different kind of bacteria that when you are plant-based. So your colon is not optimally prepared to just eat plant-based initially. So for the first 2 weeks, my bowels were irregular. Now I don't have a problem, but I do go. I'm talking, but as my wife says, what goes in has to come out. So I eat a lot, but I don't have any problems. So you get rid of hemorrhoids and all that stuff. Say that again?
The nightshade vegetables for arthritis and so forth. How much truth is there in that? I know eggplant is one of those star nightshade vegetables.
Well, we eat the eggplants, you're gonna say what, once, twice a week? And I know there are some things about, I haven't read any medical study saying that if you eat this color or that color, we want the multicolor, but I haven't read a medical study saying particularly you have to eat this, or you know what I mean? So one of my goals is to, I'm checking, is to prepare recipes for specific diseases. For example, I have patients with osteoporosis, and there are medical studies showing that when you eat certain things, the intervention is pretty much as good as medication for osteoporosis. And when you start early, when you eat all the fruits and the vegetables and stuff, you actually prevent it. And they did the study because there are many countries in the world where they don't eat the same amount of calcium that we do, but they don't have osteoporosis. It's interesting because we have a lot of calcium in our diet. And the amount of osteoporosis, the rates of osteoporosis we have here in the US are among the top in the world. So by incorporating those things, it wasn't necessarily about increasing the amount of calcium, but eating the right things that will not change the pH of your blood, not the pH of the food, but the pH of your blood so much that will necessitate your body to get the calcium out to neutralize that, and then you don't lose the bone density. So that's pretty interesting. And likewise, we have things for example, for hypertension. Many of you, like my patients, have heard me tell you before in the office that there are studies showing that if you have 2 tablespoons of ground flaxseed a day, it drops your blood pressure at least 4 points. And if you have purple potatoes once a week, the purple potatoes, they drop your blood pressure like 4 points too. And then we're talking 8 points. And then hibiscus tea, which is a flower, but you know, you sometimes see it in the grocery store, it says, you know, pomegranate, berries, whatever. If it says hibiscus in the back and you have 3 cups a day, it drops your blood pressure 7 points. So now we're talking about 15 points. I mean, that's medication combination grade drop. And if you eat soy, it's interesting how they found out about the soy. The Japanese people, they eat a lot of miso soup. And that miso soup is salty, but it has significant amount of soy and seaweed and so on. But apparently the soy keeps it from giving you high blood pressure. So when you add the soy, they were not able to quantify how much it drops your blood pressure. But even if you didn't add it and you just drop your blood pressure 15 points or more, that's pretty significant. And you don't need medications. So that's nice. Okay, so I think that we are good here. And how's that coming along?
That's good.
No, I didn't use any salt. All right, let's put a little bit of salt because there you go, thank you. But I'm just gonna try without salt the way I like it. Let me see if it is eatable. Do you want to try? I mean, this is good for me, but all right, I'll add a little bit, not too much. Not too much. Oh, look at this. This is cool. What is this? 1/4 of a teaspoon. Okay. So today, most likely, you're not going to go home and go plant-based. But if I impress on you to increase the amount of fruits and vegetables that you're eating, and I'm giving you options that it doesn't mean eating more salad, okay? That's a win. You'll get a lot of benefits from that. And we'll do the same thing about the beans. And I'll leave it here if anyone wants a little bit more. I know I didn't put salt. Okay, now we're gonna assemble them so you can try them. Oh, I forgot, hold on. We're gonna do the plant-based gelato. Who doesn't love ice cream? But, you know, according to there was a big study called the MIND diet, which is a combination of the Mediterranean diet with the DASH eating plan that brings down your blood pressure. And they noted that there was an association with dairy intake and your risk for Alzheimer's. So you should significantly limit the amount of dairy you eat. In fact, any one of you here sings. Okay, do you avoid dairy before singing? Right, it causes inflammation, it gives you mucus, and just as it does it here, it does it everywhere in your body. People with high intake of dairy, they have a lot of joint problems too. So, I'm gonna show you how to have, quote unquote, ice cream without dairy, okay? And it's very simple, and you have the recipe there. And what I do is, for depending on how many people you have in your household. So let's say that is 2, like my wife and I were empty nesters. That's very nice. So for 2 people, I use 1 banana. If you have 4, then you will use 2. You slice it, you put it in a Ziploc, and then you freeze it. I just did that today. So you get some of that out, all precisely measured, of course. And I add some. All right. And then I do my frozen berries. I bought blueberries packed with antioxidants. You should have them at least twice a week. Okay. And then you add the nuts that you like. You can add cashews, you can add pecans, you can add hazelnuts. Now, there was a small study. It's not going to get redone because there's no money in it. But they found in the small study that if you eat 7 Brazil nuts once a month, it drops your cholesterol 20 points. So we just add the Brazil nuts in there, and then we're done for the month, you know. But you can add, you know, for this I love cashews, but I'm going to tell you something about cashews. If you eat too many of them, they will give you gout. Anyone here with gout? Okay, not using the cashews. No, but if you eat too many of them, you know, so don't overdo the cashews because they will give you gout. So I'm going to use just a little bit. And what I like about the cashews, the hazelnuts, the pistachios, wow. It makes it creamy without having to add cream, you know. There you go. That's a food processor. On steroids. And then let's see here. What is this? 1 tablespoon. Okay, there you go. So we're going to do vanilla extract. One. In your recipe is just 1 in here because I'm making more. And oops. A little dash of water. So otherwise it won't run. Okay. All right, so let's see. You just hit that. And what I normally do is I don't add all the bananas initially, otherwise you get frozen chunks. But once it's smooth, then I add more. Okay. So let's see. And you can buy the frozen berries, and it's not so it doesn't take any prep time at all, and it's so delicious. You'll try it. Sorry.
What brand is
don't know. Robocoop. I guess it's an industrial one. Not what I have at home.
Not to drink milk? I mean, the milk is milk products. What do you substitute for, let's say, cereal?
Well, what I do for cereal is I smash half banana, I put a tablespoon of the flax seed, I put a half a cup of oatmeal that I put in the food processor and grind it uncooked. I mix that in. Then I do half a cup of pistachios or the nuts that you like, cup of soy milk, mix that all together. It looks like yogurt, and then I add blueberries, pinch of cinnamon, and voila, you're done.
What about almond milk?
Yeah, you can do almond milk or soy milk or the one I do advise to avoid is the coconut because it has a lot of saturated fat. Yes, coconut has a lot of saturated fat. So I don't know why this is not processing it. Raj?
Yes.
Yeah, look. Not processing it.
We keep going down the line.
Troubleshooting there. Well, while he fixes that for us, why don't we start? So normally the way I do this is put a thin bed of the rice. And I put the curry on top. And I cut and seeded the peppers and the kale. I put a little bit of kale, which is very healthy for you, in there. Put 2. I spoon some of the beans. And then
Parsley?
go ahead. I love this little thin. I slice the avocado, and do you have a fork?
I do.
And I put that on top. And that's what you're going to try now. All right? Oh, there you go. You did it. Thanks. And now we're going to add, I bought this 2 years ago. I bought this little plant for chocolate mint. And it comes out every year. I got some of the leaves from my backyard today. Here we go. We'll ask Peter. Peter, take a whiff. I think good, huh?
Chocolate mint. Oh, going in
Mint
there?
chocolate, mint chocolate. Yeah, we're going in. Gives it a mintiness.
Chocolate mint.
Chocolate.
Back there myself.
Okay. And then optional is date syrup. So what is date syrup? You take a bunch of dates, you chop them, put them in low medium heat with some water, and it makes the syrup. That's it. So it's not added sugar. Now I was lazy, I just bought that one. But you can just make it. It's exactly the same. If you look at the ingredients, feel free to come and take a look. 100% dates, there's nothing. Sometimes they just chop the dates and they melt them. No, they don't even add water. And sometimes they just let it dry and crystallize and they make date sugar. And you could use that instead of sugar in your recipes. So, oh, look at that. Perfect. So look at that. It's not a smoothie. It's plant-based gelato. And you're about to try it too. So try it, Roch. So it's not me.
So it's not you.
No.
What do we practice? No, it is really good.
All right. Okay, well, do you have any questions? If not, then calm down and we'll start serving so you guys can try it. Any questions?
I want to know
Yeah.
what cocoa nips. Cocoa nips. Your gelato. Oh, okay. Well, they
So they're just, they're before you make chocolate, so they haven't added any, you know how they make chocolate when they ferment the cocoa beans and then they add the fat and so on. This is before they add the fat. It's just, and feel free to take a look. They're just pieces of the cocoa itself. Takes like chocolate without the fat. So we normally add that on top of that, and it's good. So, all right, so, yes, let's, yes?
How much caffeine is in those cocoa nips?
How much caffeine is?
In the cocoa nips?
I don't know, but there is caffeine in it. You don't have to have the cocoa nibs.
What do you want to do, put them out right?
Yeah, we'll put them in there so you guys can come and grab them.
And there's spoons right over here, so
And then we'll have you come for the gelato.
Can I just have a little of the gelato? Oh, whatever you giving up for gelato?
You don't want to try the other stuff, Jerry?
No, I'm on my way to Boston to get a Italian
Okay.
pizza. Thank you, Doc.
It was very interesting, because it's something about red onions. They're better than the white onions, for what reason?
They have more antioxidants in them. Yes.
I like that gadget.
I know, this gadget is nice. It pre-slices the avocado for you.
Great.
Whoosh. Honey, can you help us?
no, you're good. Moving and grooving.
Okay, so we'll stop there. And
Is this a new kitchen? Has this always been here, this kitchen?
this,
No, this is just over a year old. This was done for our culinary students. This is their related classroom, so that they have all of the hands-on for the cooking that they do in both the kitchen for the restaurant as well as the kitchen for the school students. The students here actually cook all of the meals for their colleagues, their student body, each day, as well as cook. Our restaurant is open every day to the public, so please stop by. We'll be looking to add plant-based recipes. Oh, perfect, sure.
Leave it there. Smells good.
It does, yeah.
Yes, could you imagine being a high school student and having this at, where you're learning your lab each day? Wonderful.
One of the main challenges of eating plant-based is going out to eat. Because normally they just have salads or they have things that are like drenching oil. They're not very healthy. So I'm hoping that we can knock on the restaurant's doors and do presentations like this and see, because I mean, the chefs know much more than I do. I'm not a chef. See if they can come up with nice recipes.